Hi, I'm Sandra Ggirl. I'm in the Addictions and Mental Health program at Algonquin College. I will be chatting about the importance of breaking the stigma around harm reduction practices with a focus on youth substance use. What is stigma? Stigma can be thought of as a mark of disgrace, where we're made to feel bad, discriminated against, or shamed based on our choices or in things that we have no control over, such as race or culture or addiction. What is harm reduction? We use harm reduction methods every day in our lives. Examples are shown in the pictures. In 2021, the Public Health Agency of Canada stated that zero-tolerance, abstinence-based approaches to substance use have limited effectiveness for our youth population. It's important to know that a harm reduction approach does not promote drug use. Rather, it aims to reduce the harms associated with drug use. Harm reduction values respect, choice, life, and compassion over discrimination, judgment, punishment, and stigma. Harm reduction interventions are vital for college students, where binge drinking has become a social norm. Harm reduction practices may be more effective than abstinence-based programs for addiction for some people. The Public Health Agency of Canada acknowledges that zero-tolerance, abstinence-based approaches to substance use have limited effectiveness for our youth. We need to break the stigma around the discussion and practices of harm reduction. The Canadian government has stated that substance use and risky behavior prevention strategies must continually adapt to changing behavioral patterns and trends to stay relevant to our youth. Harm reduction practices are actually risky behavior prevention strategies that our youth and their parents should become more familiar with to allow for open, realistic, supportive dialogue to keep our youth safe. Family support has been shown to protect against youth substance abuse. So this type of information needs to be discussed not only at school but at home and between peers. If high school-aged teens choose to drink, it is recommended to limit drinking to no more than 1 to 2 drinks at a time within a week. I do want to remind everyone that it's illegal to drink or possess alcohol if you're below the legal drinking age. And reinforce that in some cases, 0 is the safest choice, in which case we ideally just say no. But we need to break the stigma of harm reduction. Public stigma related to harm reduction may be one of the most predominant barriers to accessing treatment today, particularly to address the opioid crisis. According to nearly 70% of respondents in a study who were aged 15 to 24, finances were listed as a barrier to substance abuse treatment. Economic stability directly influences other determinants of health, such as food security, housing, healthcare, and education costs. Not only does harm reduction practices keep more money in wallets for higher education, food, and housing, but it serves to protect against exacerbated mental health issues that are a risk factor for high-risk substance abuse. Harm reduction should not be a taboo topic or practice. It saves lives. Let's break the ice and break the stigma. Let's talk about harm reduction. And please, let's not pressure other people to use. For more information about how to reduce harm related to a wide variety of substances, visit harmreductionto.ca. That's harmreductionto.ca. Thank you. There's a list of references that you can pause the video on if you're interested in taking a peek. Thank you for watching.